name is Johnson Kiza from Public Health Ambassadors Uganda. Public Health Ambassadors Uganda is a youth-led organization that champions efforts and supports, also empowers young people to make informed decisions about their sexual, reproductive health, and mental well-being. And we are honored to be part of the launch of the National Population Policy 2020, which is timely and also important for us to achieve the demographic dividends. And from the previous speaker, when we talk about the demographic dividends, I think one of the main focus is on young people, most especially adolescent girls and young women, because a lot of statistics that are contributing to the dependency ratio are associated with adolescent girls and young women. And that's where also our focus and efforts as Public Health Ambassadors Uganda lie. So I'm here to introduce some edutainment presentations. And the first one is going to be a poetry video. Now, we all know that the COVID-19 pandemic came into Uganda last year in March. And since then, it meant a lot of things for young people. And most especially in regards to accessing services and information to do with sexual and reproductive health, with the emphasis on contraceptives. So the video we're going to witness is a snapshot of a research that was conducted by Makerere School of Public Health, supported by Guttmacher Institute from US and Public Health Ambassadors Uganda. And basically this research was on access of contraceptives among young people. And this video just shows you what the pandemic So this video just shows you what it meant, the COVID-19 pandemic and the lockdown meant for different young people regarding accessing contraceptive methods. And I think if it is ready, the previous speaker invited their guests back on stage, but I don't know how they are going to. But I think we'll see. Okay, so yes. So ladies and gentlemen, let's enjoy.
It was the third month of the year 2020 that the COVID-19
the sound fine? So maybe as a fixed sound, let me. Okay, so as they fix sound, I'm going to invite another performance. I'm going to invite another performance as the tech team fixes sound. So this performance is from a young lady, 21 years, and she's representing many adolescent girls and young women in the country, and she's representing their issues.
to our country. I still will.
Okay, sorry about that. So I think the tech team has fixed the sound. So let's first watch this video.
It was the third month of the year 2020 that the COVID-19 that we just used to hear about squeezed itself in to our country. I still remember like it was yesterday. I mean, who can forget the virus that can literally take the whole world's breath like we once knew? No more. Now we just social distance ourselves into a new normal. See, I still remember my TV. Never before had my president overly frequented my TV. My anxiety was all the way up as he declared a total lockdown. Stay home, stay safe, silence. The only sound I could hear apart from my heartbeat was the sound of sirens. There was no doubt we were under attack and we needed to step back. But then, the inevitable. We were hit by a domino effect of unpleasant setbacks.
The beginning of the COVID-19 pandemic and the lockdown meant a lot of things to a lot of young people. For example,
Johnson, a casual laborer mu kikuubo, yali yasalawo ye ne munne Nakawunde nti ensonga y'okubeera abazadde bakira bagigumiikirizaako nti lupiiya bakira bamuyiiyayiiya mpola mpola era nga Johnson mwattu tava ku bupiira bugali mpitawa. On his way to work, he always passed by the local health center to get some free condoms. This was his way of planning for his family's financial freedom until COVID-19 threatened this very freedom. You see, he was still willing to brave the long distance to the health center, but the health worker that used to stock up with the free condoms was having trouble accessing the health center, and so Johnson had no access to free condoms, no direct source of income or livelihood, and he was forced to start contemplating the thought of fatherhood.
And what about his partner, 19-year-old Nakawunde? Mukazi watu asubula matoke mukatale ke Kaleerwe. She is always cautious and protects herself from any STD. Era ku nsonga ya family planning, yali yetegeka kufuna IUD. Naye mwono kafiwa COVID, yali asinga kutya nnyo kiboko z'aba LDU. The distance to the nearest health center was not favorable for her business, and she had to follow the presidential directive to camp at the market. Unfortunately, this hindered her family planning target. The beginning of the COVID-19 pandemic and the lockdown meant a lot of things to a lot of young people. For example,
Patrick, Pavin's boyfriend. See, public transport was closed, so his border business was paused, and he literally thought that his life might end. He had messed up and gotten his girlfriend pregnant. Patrick and Pavin, out of panic, procured an improper abortion plan that almost ended Pavin's life. Both were scared. They desperately needed some post-abortion care. But the nearest health facility was miles away from where Patrick and Pavin lived, so their anxiety started to peak.
And what about Pavin, who is in her teens? School is closed, she is at home. Her thoughts hold a million things, and since she is in her teens, sex is an inevitable thing to think about at least. At school, the senior woman teacher openly spoke about sex education, but at home with her parents, anything concerning sex is out of the question. So silence is her answer, the beginning of a cancer.
You see, the beginning of the COVID-19 pandemic and the lockdown broke down almost every sector of our nation. And of course, the health sector took a direct hit. And the reproductive health of our youth wasn't spared a single bit. See, COVID-19 hasn't been lenient, but thankfully, our health system has and still is resilient. We thank our health workers who braved the inconvenience. We thank every single frontline soldier that fought to deliver the necessary health services. We will forever remember your names. It is because of you that we are now doing much, much better. You see, the first few months of the lockdown saw the adolescent family planning service visits dip for obvious reasons, like access was limited because public transport was closed. But you see, this dip wasn't that deep because soon enough these visits started to rise quick.
And statistically, things returned to normal for the rest of 2020. A research by Guttmacher Institute and Makerere School of Public Health says that we performed better than the years before 2020.
Fast forward to 2021 and there is still work to be done. So while we still wear the mask, we need to be aware of the task. COVID-19 is still here, but so are we.
We have been hit hard, but we can recover better, stronger and healthier if governments and all stakeholders accelerate access to utilization of contraceptive methods. Together, each step forward.
Thank you so much, ladies and gentlemen. We shall have more